Hi, this is Dr. Robert Norman. Glad you're here. This is the Brain-Skin Connection series, The Outer Brain, the Incredible Power of the Brain-Skin Connection. This is from the Norman Center for Neurodermatology. We're investigating the interactions between the brain and the skin in relationship to disorders such as melanoma, Alzheimer's disease, Parkinson's disease, autism, neurodermatitis, and other neurocutaneous diseases. What is our goal here is to translate skin-brain research into effective behavioral strategies that prevent disease, promote healing, provide treatments, and enhance well-being across the lifespan. Vitamin D is a lipid-soluble vitamin, also known as a sunshine vitamin. It's synthesized in our skin in the presence of sunlight. Vitamin D is strongly known for its role in calcium and bone metabolism and maintaining bone integrity. Scientists, with the support of multiple types of research, have linked this hormone-like vitamin to some disorders throughout the body, such as cardiovascular disease, cancer, stroke, metabolic disorders, and also diabetes. So there was a meta-analysis done with vitamin D related to COVID-19. It took 21 eligible studies that were found to be relevant to the relationship between vitamin D and COVID-19 related to infections and outcomes. The objectives were to check the continuing threat of COVID-19 to the public, and in addition to vaccination, seeing if the use of supplements to support the immune system may be important. So the purpose of the study was to synthesize evidence on the possible effect of low serum vitamin D levels on COVID-19 infections and outcomes. Now, according to the results of this vitamin D and COVID-19 meta-analysis, vitamin D deficiency may increase the risk of COVID-19 infection and the likelihood of severe disease. Now, we have recommended this for years, even prior to COVID-19 in our patients, and we regularly check the vitamin D levels. We are now recommending more vitamin D supplementation to prevent COVID-19 and its negative outcomes. Vitamin D aids in the function of neuronal and glial tissue, and there are many health consequences in a person with vitamin D deficiency. Some of the effects of vitamin D deficiency include the development of dementia caused by the increase of cerebral soluble and insoluble amyloid peptides and a decrease of its anti-inflammatory, antioxidant properties. There is a link to depression from vitamin D deficiency by reduction of the buffering of increased calcium in the brain. And vitamin D deficiency in expecting mothers links it to the development of autism and schizophrenic-like disorders, hypoxic brain injury, and other mental illnesses. Vitamin D deficiency is linked to the development of diabetes, and its role in neuronal development and a decrease of microglial inflammatory functions can lead to increased brain infections. So in summary, cognitive impairment, dementia, psychosis, and autism have been added to the list of problems related to decreased vitamin D levels. And in reducing the risk of these diseases, it plays an important role as we're seeing increased portions of the population in both developed and undeveloped countries having a significant amount of vitamin D deficiency. The older population is at unusually high risk for vitamin D deficiency due to the decreased cutaneous synthesis and dietary intake of vitamin D. Vitamin D receptors are widespread in brain tissue, and vitamin D's biologically active form has shown neuroprotective effects, including the clearance of amyloid plaques, which is a hallmark of Alzheimer's disease. Recent studies have confirmed an association between cognitive impairment, dementia, and vitamin D deficiency. And we are seeing that the newest literature shows that a higher serum vitamin D level and concentrations either in utero or early life may reduce the risk of autism. Vitamin D was reported to modulate the biosynthesis of neurotransmitters and neurotrophic factors, and its receptor was found in the central nervous system. So in summary, I think it's very important. I write prescriptions for my patients for vitamin N or Nature, so they don't need a prescription, but it's a recommendation. It's free to everyone. You should increase your exercise, appreciate the beauty of nature, and you can live longer. So I say get out, enjoy the great outdoors, and get your vitamin D. Of course, it's important that you get it in your nutritional intake. And vitamin D, sunblocks, and various opinions are usually contested. It's one of the hottest topics within dermatology. How much sun exposure should we get? Because we're also concerned about skin cancers. And there are even issues as far as using sunblock, because some people say if they use sunblock, they rely on that, they stay out in the sun longer, don't keep putting on the sunblock, and that allows them to be more prone to skin cancers. So having said this, as with all problems with humans, there are differences of opinion and controversies. But in general, I recommend being out in the sun 15, 20, 30 minutes a day when you can, using your sunblock, getting exercise. It's good for the brain, the skin, and everything. Here's a good picture of a young man out meditating. This is what you should consider doing, being out in nature and relaxing. And in summary, vitamin D is essential to maintain important functions of the body, such as calcium homeostasis, as I mentioned, along with maintenance of skeleton integrity, and most importantly now, neurodevelopment. We found more and more about that lately. Its deficiency has been linked to many problems such as dementia, depression, diabetes, autism, and schizophrenia. As important as this topic is emphasized, since correcting the deficiency state can help prevent many negative health consequences. So get out, get your vitamin D and your vitamin N. References, and I'll go through these over the next few pages. Here is another list of references and another list, and you'll be quizzed on every one of these in detail, so study all of them. More references. And my next talk will be on brain fingerprinting.